We are at 1 o'clock, so I will begin the meeting. And can we begin with a roll call, determination of quorum?
Yes, Councilman Dare? Councilman Dare?
Here.
Mr. Reese?
Here.
Chief Brown?
Here.
Dr. Denka? Dr. Novak?
Here.
Dr. Clacking?
Here.
Commissioner Alexis Hill will be absent. And I'm your recording secretary. Health Officer Dick, we have a quorum.
Thank you. I'd like to ask Vice Mayor Reese to please lead us in the Pledge of Allegiance.
Put them to work right away. Let's do it.
Friends, please join me as we pay honor to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, thank you, and I'd like to welcome Devin Reese, Vice Mayor of City of Reno, to the Board of Health as our new appointee, elected appointee from the City of Reno. He was appointed on October 12th, and that's for a 4-year term on the board. And I don't know if you'd like to make any introductory remarks to the board.
Thank you, Mr. Dick. Appreciate that. I'll just say thank you for having me. I know this is a great group of folks working in the service of this community, and I'll hope to add some small part to that. So I'm proud to be here, and thanks a lot.
All right. And then as you heard, as we did roll call, Alexis Hill, Commissioner Hill, was appointed on Tuesday to the board, and unfortunately has another conflict today. So I am beginning this meeting because we don't currently have a chair or a vice chair. So our next item is to elect a chair and a vice chair, and this is for the remainder of the 2-year term that will end at the end of this year. And then we will have subsequent elections in January for filling our officer positions on the board for the following 2-year term. So I am looking for nominations.
Mr. Chair, I would like to nominate Councilman Dare to be our new chair for the remainder of this year. He comes from Sparks, so he's well recommended by the whole Sparks delegation.
All right, we have a nomination for chair. Do we have a second?
Second.
I think that I'm going to give that one to Dr. Clacking for second on that. Any discussion on the chair, on this motion? Okay. With that, then I will call for a vote. All in favor, please indicate by saying aye and cast a vote on your iPad.
Aye.
And
Thank you.
I think if you click on it, the blue highlight up further. No.
We're almost there, folks.
Vice Chair, I can vote for you if you like.
Thank you.
Thank you so much. My vote was in the affirmative, of course.
You want to finish that? You want to do the second, or you want me to take it?
So I think we're having a few technical difficulties with the vote, but we have a unanimous vote. So congratulations.
Thank you.
Mr. Chair, and I will turn the gavel over to you. Do you want to then proceed with the?
Thank you. I'd like to say something real quick first, and I just want to say thank you. Thank you to my peers that are willing to stand with me. We've been through obviously so much in the last couple of years, and I do think there's a lot more work to be done. And it's kind of weird. I've been on this board 6 years now, which is crazy how that time flies. I think you You didn't have gray hair then, Kevin, I don't think. No, I'm just kidding, you did. But
Mike
we,
had hair.
so you get to hear some of my bad jokes as we go along, but we're going to have some fun in here, and I just am honored to be able to sit in this seat. So we'll go ahead and go on to the election of vice chair, and I would actually be looking for a motion for that. Yes.
Mr. Chair, I would like to nominate Mike Brown, Chief Mike Brown, to be our vice chair for the remainder of 22.
And I have a first. Do I have a second? Second. I have a second. Any discussion? All in favor, say aye,
Aye.
and then vote on your computer if you are able. We are going to take a break right now anyway. They have been a request for that, so we're going to take just a couple-minute break so they can adjust some things on here with the new chair and vice chair, making sure all of that's right. So I can kind of halfway be in control of the meeting, they said. So with that said, say hi to each other and a high five, and we'll be back in a moment.
Chair, can I get the second? Who seconded the?
Second was Dr. Clack.
Thank you.
So we're on break.
He just wanted to use the gavel. So far, so good.
I think we're going smooth. Except for the technology. I believe that is.
I can't believe Devin's been here 10 minutes, he's already broke it.
We are a well-oiled machine. Welcome aboard. And then Gloriana already said chair. I have 3 devices and a piece of paper in case anything goes down. I'm prepared.
Right there.
Gloriana, is that voting issue maybe what Josh was talking about? No, he left. Well, I can manually vote for them if they like for this meeting.
Well, the biggest part of our presentation walked in.
Yeah, it's kind of the crux of it today.
Should we ruin our day and just table the motion?
Yes. We table the agenda. Oh, but then December will be so long.
You can yell at her. Hey, Susie. Mike Brown.
Was Dr. Denko able to vote? Was Dr. Denko able to vote? Okay. Do you want us to wait to troubleshoot it? Chair, we're ready to. Yeah, we can be. I'll vote for him.
We're going to go ahead and reconvene Washington County District Court of Health meeting on this fine Thursday, October 27, 2022. And let's go ahead and our next step 5 is we need an approval of the agenda. Do I have anybody who would like to have a conversation about the agenda?
I'll make a motion to approve the agenda as presented.
Second.
I have a first and a second. Any discussion? And so I'd say all in favor, go ahead and vote. Aye.
Aye.
Any opposed? Passes unanimously. And let's go ahead and move on to our recognitions. And I'm going to pass that on to our health district officer.
Thank you, Chair Dare. I'd like to.
Say that. Sorry.
All right. I'd like to begin with new hires. And we have Rachel Cord, Assistant Clerk 1 in AHS. And I'd like to introduce Rachel. If you could please stand, Rachel. Anna Heenan is not attending today. And Rachel is a native Nevadan. She grew up in Fallon. She has a bachelor's degree from the University of Utah, and Rachel is rejoining the Health District. She worked in this position from 2019 to 2021, and I heard her soothe and calm a number of distressed people during the COVID-19 pandemic in her position, and she says that she loved working at Health and was extremely happy to return to her old position in Administrative Health Services. So welcome.
Good job.
And congratulations. And then I'd like to ask Lisa Lotritz if she could introduce Patricia Onsiwai to us.
Is it on? Yes. Lisa Lotritz, Division Director for Community and Clinical Health Services. Good afternoon. I would like to welcome Patricia Onsiwai to the Health District and to CCHS. Patricia started on October 24th as a Human Service Support Specialist in our WIC program. She will primarily be working at our Moana WIC, but she's training here at 9th Street for a couple weeks. Patricia has her master's degree in public administration from San Francisco State University, and she's worked in human resources as well as at the Washoe County School District. So we're glad to have her join our team. Thank you.
Welcome.
And please stick around. We'll be doing pictures after the proclamation. Next, I'd like to recognize Brendan Schneider, who has been promoted from an air quality management specialist to a senior air quality management specialist, and I don't believe that he's with us today. But congratulations to him on his promotion. We have a number of Washoe County Health Heroes, and I'd like to begin with Kara Roseborough. If you could please stand, being recognized for trustworthiness, professionalism, and partnership and collaboration. So thank you. We have Don Spinola. I don't believe Don is here today. Also recognized for trustworthiness, professionalism, and partnership and collaboration. Lori Griffey. Lori, if you could please stand, being recognized for all three of those values as well. And Nanette Kano, please stand, also being recognized as a health hero for demonstration of those three values. And Kristen Palmer, all over there in the same group, being recognized for those values. Susie Valdespen up over here, so congratulations and thank you for your efforts. And Katie Doyle, and I believe Katie may be doing homebound vaccinations today, so thanks to her. We have a couple of honorable mentions, Rebecca Gonzalez and Laura Huntsman also. So really want to thank all of those employees for going above and beyond and being recognized by their peers for those efforts for the Health Heroes Award. We actually had a real nice recognition luncheon. When was that? A week or 2 weeks ago, and Christopher Dare was able to join us for that. So that was
Enjoyable.
That was nice.
It was awesome to be with y'all, and definitely.
all right. Shall we move on to proclamations?
Yes, we're on proclamations for the Red Ribbon Week proclamation. Is there somebody here to receive this?
Yes, I would like to ask if we could have, let's see, we have Joe Dibble, I believe, is joining us, as well as Dr. Yolanda Chatwood from Join Together Northern Nevada. If you could join me down at the podium for the proclamation. Whereas alcohol and other drug abuse in this nation has reached epidemic stages, and whereas it is imperative that visible, unified prevention education efforts by community members be launched to eliminate the demand for drugs, and whereas the National Family Partnership is sponsoring the National Red Ribbon Campaign offering citizens the opportunity to demonstrate their commitment to drug-free lifestyles. That is, no use of illegal drugs, no illegal use of legal drugs. And whereas the National Red Ribbon Campaign will be celebrated in every community in America during Red Ribbon Week, October 23rd through 31st. And whereas business, government, parents, law enforcement, media, medical, religious institutions, schools, senior citizens, service organizations, and youth will demonstrate their commitment to healthy, drug-free lifestyles by wearing and displaying red ribbons during this week-long campaign. And whereas the Washoe County Health District and Join Together Northern Nevada joined organizations from around the nation in support and promotion of Red Ribbon Campaign. And now, therefore, be it resolved that the Washoe County Health District does hereby proclaim October 23rd through 31st, 2022 as Red Ribbon Week and encourages its citizens to participate in drug prevention activities, making a visible statement that we are strongly committed to a drug-free state. Adopted this 27th day of October 2022, Christopher Dare, Chairman, Washoe County District Board of Health.
Yeah.
Here's
You guys want to say anything?
your proclamation, and you're welcome if you wanted to make some remarks.
Good afternoon. For the record, this is Joe Dibble with the Washoe County Health District Injury Prevention Program. Washoe County Health District is a proud partner of Join Together Northern Nevada, a nonprofit coalition whose mission is to create healthy, drug-free community by building successful relationships to support prevention, education, and outreach. Dr. Yolanda Chatwood is a certified prevention specialist and deputy director of Join Together Northern Nevada, and I'll give her the floor at this time.
Thank you. Good afternoon. Since its beginning in 1985, the Red Ribbon Campaign has touched the lives of millions of people around the world. In response to the murder of DEA agent Enrique Camarena, parents and youth in communities across the country began wearing red ribbons as a symbol of their commitment to raise awareness of the destruction caused by drugs in America. Today, the red ribbon serves as a catalyst to mobilize communities, to educate youth, and encourage participation in drug prevention activities. JTNN has partnered with the Washoe County Health District, Washoe County School District, the DEA, and the Nevada Wolfpack Athletics to raise awareness around the continuum of care and support our community in making healthy choices for ourselves, for our friends and family, and for our community. We believe that prevention activities that raise up community resilience create an environment in which all people can thrive. We stand in remembrance of Agent Camarena and all law enforcement that die in the line of duty to make this world a better place for our children. Substance misuse is a complex issue, and it requires that all people come together to make a difference. Thank you, Washoe County Health District, for standing with us in remembrance and engaging in thoughtful decision-making that supports healthy choices, diminishes stigma, and recognizes prevention as a way to reduce the harms that legal and illicit drugs cause. Thank you.
Thank you. And Dr. Denko, I know we serve on this board, and so I don't know if you have anything you want to say. Is there any?
So much to say. Actually, an opportunity to be on the board with JTNN, I believe since 2015-ish, and a phenomenal organization doing so much on the side of prevention and education and community and family support. So thank you for everything and for the opportunity to be in collaboration with you.
She's my mentor. I've been on there for a month, so. Thank you so much. We're going to come down and take a picture with you. Are we ready for that? Oh, I'm sorry. Yes, we need to vote for us. That is important. Do I have any more discussion or a motion?
I'll make a motion to accept as presented.
We do have a first. Do I have a second?
Second.
I'm going to let Danko do it because she's on that board. So you got
You can make
first and second. Is there any other discussion? I don't hear any. All in favor, say aye.
Aye.
Any opposed? And please vote online if on your computer too. It passes unanimously. Yay!
Yay!
All right, why don't you stay down here and we'll start with your pictures
Okay.
for the proclamation.
Sounds good. Thank you. Then do the rest.
No, to you.
We have more coming.
That'll make you feel better.
And let's see, I gotta find these Thero awards now. And how about Kristen and Lori and Jeanette? We can do these separate ones. You want them all together? Uh-oh. Okay. Are we all gonna do that?
Now, I don't know you guys realize this, we serve on a lot of different boards, but this is the only board where we come down and take pictures and stand with those who get awards and are new. I just want to tell you, that's how cool this board is. So, we're on to public comment. Do we have any public comment?
No, we do not.
No, we don't? Okay, very good, that is on. Let's go ahead and go on to 9. We have our COVID-19 monkeypox update and information from Health District Officer Kevin Dick.
Thank you, Chair Dare. I'm pleased to report that we're in a pretty good situation right now with COVID-19. Our 7-day new case average stands at about 30 new cases per day, and it's been fairly steady at that level. And our wastewater levels are remaining low for COVID-19. The state is reporting 25 confirmed or suspected hospitalizations of people with COVID-19 in Washoe County. Nevada Hospital Association is reporting that the hospitalizations are remaining flat. And that's just 2.1% of staffed inpatient beds that are being used for people with COVID-19 in the hospitals. Our positivity rate has gone down a little bit in the last few days to 13.3% positivity. We did a vaccination pod yesterday at the Discovery Museum where we provided both COVID-19 bivalent vaccine and the flu vaccine. We're at the convention center this afternoon. We'll be up in Gerlach on November 9th. That convention center on Thursday afternoons is a regular weekly community pod event that we're doing, and we're also continuing to offer the vaccine in our clinic. The vaccinations are being dispensed at a rate of about 6,150 a week in Washoe County. And of those, about 5,800 of those are the bivalent boosters that are being provided at this time. And the health district is only accounting at this point for about 7% of the vaccinations that are administered community-wide. But we really need people to step up and to get the new bivalent booster that's available. We do have the fall respiratory virus season that's happening, and at this point we have less than 10% of our population that's received the bivalent booster. So we'll be continuing to message, encouraging people to get that booster as well as to get the flu vaccination. At this time, we're not seeing the impact in the hospitals as you've seen in the news from RSV nor from flu or COVID. So we are seeing an increase in RSV cases. It's the seasonal period where we expect to see that, but so far we're not seeing the impacts that we've seen occurring in the Northeast. And as far as monkeypox, we're at 21 cases. So our rates of new cases has really decreased significantly. We do have TPOXX available for treatment. People do get monkeypox, and we also have vaccinations available for high-risk individuals and close contacts. So that's my update, and I don't know if Dr. Danko.
I have anything new to add? We'll see what fall and winter bring for us.
Thank you very much. Any questions, discussion? Any board members? Okay. Thank you very much, and that is very good news. And let's go ahead and go into our consent items. Do we have anybody want to pull anything? Or do we have a motion?
So moved.
I have a motion from Mr. Novak. Do I have a second?
Second.
I have a first and a second, and any more discussion? All in favor?
Aye.
Any opposed? Passes unanimously. Please make sure you vote on your pad as well for everybody. And we're moving on up. Okay, we are on to our Regional Emergency and Medical Services Authority, and I'm going to have Mr. Barry Duplantis join us. And you and I matched today, I think. Close. Nice tie. Thank you.
Good afternoon, Chairman Dare and members of the board. I'm Barry Duplantis for the record. You've all received a copy of REMSA's September Franchise Compliance Report. In September, REMSA came in at 88% compliance with Priority 1 calls in Zone A and 91% compliance in Zones B, C, D. September was a very, very challenging month for us with all of the special events that took place in our community, and call volume was exceptionally high. Having said that, however, and as stipulated in REMSA's franchise agreement with the district, REMSA remains compliant year to date in both the A zones as well as B, C, D zones. So on a year-to-date basis, REMSA remains compliant. Now, having said that, of course, you know, in my next section, I will talk a little bit about some of the remedial efforts that we are undertaking to ensure that we are regularly compliant. But I just wanted to point out the fact that that is a regular item of review for us and adjustment at REMSA. RIMSA continues to focus on hiring and adding new members to the team. At this point, we have 161 employees who are focused on clinical care of patients. And we'd like to increase that to about 180. We're always hiring. I mean, so that is a relentless activity for us. I might also point out in the month of September, just to give you a sense for volume, that we responded over 8,000 times to 911 requests for service. And of that, we transported 4,907 patients. So almost 5,000 patients were transported to area hospital for advanced levels of care. Works out to be about 6 out of every 10 calls that we go on, we transport the patient. So my point of making, or I should say of highlighting those numbers, is to bring to your attention the fact that the demand for EMS services in this community continues to be strong year over year. And what we're also seeing is higher levels of activities in the fringes of the communities, such as North Reno, South Reno, Verdi, Spanish Springs, Winfield Springs, areas that have traditionally not had a whole lot of population are now exploding in growth, hence creating the demand for services in some of these more challenging areas. I will also point out that in your packet is a copy of the EMS survey for which we improved slightly on. But as I've discussed with you in my previous comments, we continue to look at the survey. One of the issues that we've discovered that bogs down the results is the fact that demographics are collected after the fact. We are not an organization such as an emergency room, for example, where we would collect demographics at time of service or even on the phone prior to service. We collect demographics after the fact. So we perform the service and then, of course, have to do a bit of research. But we're nevertheless looking at how do we improve survey results to get better information. And then lastly, in this section of my report, I simply want to also comment on the another requirement that's in our franchise agreement, which is that of an annual audit. We are in the process of doing that with an independent accounting firm who is examining our books and records. And I expect that we'll have the audit report available in the month of December. Typically comes out right at about mid-December, and then we share it with you in January as required by our franchise agreement. So that is underway at this point as well. That is my report with regard to franchise compliance. If you don't mind, I've got the next agenda item as well, which is to talk about remedial efforts to improve compliance. So if okay with you,
Yeah, go ahead. And then, because then you might answer the question that somebody has with
Okay.
that, so thank you.
So as
We need
noted
to have a
in...
motion on that first, though?
Yeah.
Okay.
Okay.
Well, then let's go ahead and have a conversation. Is there anybody that has any discussion on this particular thing before we make a motion? Okay. With that said, do I have a motion then?
So moved.
I have a first, second. Any other discussion? Seeing none, all in favor?
Aye.
Aye. Any opposed? None, passes unanimously. Please continue, sir.
Okay, thank you very much. So as I just commented with regard to the call volume, a number of things that we're doing that I just would like to highlight. So we've increased the number of shifts that we use to support the community from 62 to 71. But keep in mind that we are constantly hiring to fill these shifts, because whenever we have people who call in sick, that compromises our ability to fill those shifts. So 71 shifts is what we would like, but we are not always able to have 71 shifts in active duty as a result of staffing. One thing that we are doing at the present time, we're in the process of rolling this out as well, which is arranging for an on-call, or I should say we are reactivating an on-call policy that we've had and not used a whole lot, but in order to increase our depth and breadth of workforce, we are activating our on-call policy so that we can have folks who are ready to engage when people call in sick. So we're looking at how do we continue to reinforce and boost our staffing, and that is one area that we think might provide some assistance. I will also say, as I reported in my last report, that we've been networking with the fire agencies, all of them, and asking for their help to help fill per diem shifts with qualified medics. One of the issues that we've had, which makes that just a little bit slow to bring into reality, is that we have to onboard folks. It's not just a matter of them showing up and putting them in an ambulance and asking them to run calls. We've got to acclimate them to our charting system and protocols. So it takes a while. But as we speak now, we do have some of these folks that are filling shifts and sitting in seats and serving the community. And that is going to be an ongoing item from here on out as we continue not only to collaborate with our partners, but also participate in regionalization, which I think will help to bring that issue even more to the surface of a community-wide effort. As I mentioned, one of the issues we've got is we've got 161 clinical workers. We'd like 180. We continue to hire, but one of the things that we are very, very mindful of is that employee retention is clearly something that's got to be a priority. And we're working very hard to improve employee satisfaction. Even though we're in a difficult industry, I think the way we treat people, the way we treat each other in our company, if we can at least help people to feel appreciated and respected for what they do, I think that, you know, certainly would help in some small way to encourage people to stay with our company. EMS turnover is just a fact of life. It happens in all areas of the country with people that are in EMS, but I think that everything we can do to try to make people comfortable in their jobs and respected for the work that they do will help to manage or maybe slow down the turnover in some small way. And as I said, compliance is something that we not just report to you here monthly, but we track every single day. We look at how do we do, where were the lates, and what could have been done different to avoid that. And as I said, it's based on that data that I can certainly share with you that the growth in the fringes of the communities that I mentioned is an ongoing development. I mean, and we will continue to look at how do we better serve those areas. And with that, I'm happy to take any questions you might have.
Let's open up for discussion. Mr. Novak?
Yeah. Barry, I want to commend you on all the efforts you put in the last couple months. I know there's been a lot of efforts to improve times and everything else. It was noted that there was a pay raise got passed on to some of your members in the last 2 weeks, and I know that's always appreciated, and that helps towards retention a lot. So, but I do want to, in your scores, in the executive summary, and I know this is something you and I have talked about, that's probably not enough people to really make it statistically important, but we're still running below the whole national average some. So, and I know that's just a difficult thing to do, but I just want to, we still need some work on that area because it's all of them.
I share your concern in that, but let me maybe just kind of elaborate. One of the things that we are looking at, and I think we're pretty far down the track at doing this, is we've even considered the concept of having kind of like a business card, if you will, where the medics can fill in their name and provide, you know, the patient with the ability of how do you get a hold of us right away to provide us with feedback. Because I also feel like because we are a little behind in our billing with the implementation of ImageTrend, the new billing system, it's creating a lag between the time of service and the time of survey. And I think that's also a barrier. So we're looking at what can we do, what are the remedial things we can do to help get feedback right away. Because I think the sooner we get that feedback, the sooner we're able to work with it. Good or bad, we want to know.
I think one thing that I continue want to have effort towards is the 3,000 of people who are not actually transporting. There's always going to be some that decided not to, but that's a fourth of you guys going out, and that has to, the more we can, more communication and the more education we can do for people to find other uses, not calling you guys if it's not a true emergency will only save you so much time and so much helpful. So I'd say that please continue to let us know those efforts you're doing, and then even how I know Sparks, Reno, and County, how we can help keep that word out, because this isn't just a concern just for you. This is our concern at large for our whole community. How do we make sure we're there and the people when they need them the most? And so I know we've done some work, we've done some communication, we've done some videos personally with some of y'all, but I'd say that we're not done. People have to hear it like 15 times before they think they heard it. So we need to really find multiple ways to put it out there. Is there anything going on? I know that might be the next conversation on the next item, but that would be something I'm interested in showing some more support to.
Well, with regard to getting the word out in terms of patient navigation and options, and Alexia will speak a bit more to that, but that is something that has to be ongoing. It's not just something that we do once a year. I think it's just a continuous message that has to go out to folks that 911 should not be the easy button for access to healthcare. And unfortunately, that's what's happening. And I don't know if it's being driven by all of the folks that have moved into town and maybe haven't set up primary care relationships, and everything is fine until it's not. And at that point, they're using 911 as the entry. It's hard to know, but we have got to continue as community to put the word out, because as community, we've only got so much to work with. We've only got so many people. We've only got so much equipment. And the answer is not just to go out and buy and hire, an infinite amount of stuff. We also have to be smart about how we use the resources we have. And so that is a continuous component. But I would also like to move on, as you're indicating, to the next item, and we can share a little bit more about what we're doing in the way of community education.
Thank you. Any other discussion or questions?
I had one more. Barry,
Yes, sir.
The numbers of almost 5,000 transported and 8,000 responses, I think that's probably the highest I've seen since I've been on this board. Is that, how much is it, if that's true, how much is it growing this year over last year in transports and responses?
Based on
What's the rate of growth?
I can tell you that year over year, it seems, based on the calculations, it's about 7% year over year.
And you budgeted for that?
Yes.
Okay. Did you budget for the gas prices?
I'm happy to comment on that one too. Our fiscal year starts July 1 and runs through June 30. So the price I budgeted for gas is $6 a gallon. So right now, with it being about 50 cents a gallon less, and given that we consume 700 gallons a day, I'm really excited that it is not $6 because obviously there's a positive variance there to our benefit.
Thank you. Thank you. Okay, can I get a motion?
Motion to accept as presented.
We have a first, we have a second, and any more discussion? All in favor? Aye. Any opposed? Passes unanimously. Very good. And we will go ahead and
Good
move on
afternoon.
to Miss Alexia Jobson.
Good afternoon, Mr. Chairman, members of the board. Alexi Jobson, Director of Public Relations for Remsa Health for the record. You have for your review the Public Relations Report for September, and I'll share a few more updates with you, but I'm also happy to address the question about helping the community understand the importance of proper patient navigation. Our Choose the Right Care campaign continues to be available. We have some social posts rolling out about it, as well as a boosted social paid campaign on social media, helping people understand that. We did take a little bit of a break through the end of summer, but now, especially as we head back into flu season and we're seeing the uptick in RSV, that we are going to recommit to helping people navigate to the right care level and really reinforcing that message, which is something we typically do every fall. So I loved being reminded, yes, that we had some good video collaboration, and I do think there's some good opportunities to reach back out to our partners for the fall season.
And I'd say this, and I don't, something I did and what we're talking about, and I would encourage us, I know, Devin, you just got here, but we're going to put you to work, but get this nice, handsome man on a TV screen talking about it to Reno, and I'm very serious about that. And utilize, utilize the Dr. Danko that we have that talks about, utilize who you have up here. And I say that because we get to sometimes be more known in the community, sometimes they listen, sometimes whatever. And so I would hope that that would be a part of what we do. We're here to help, not just not complain, but have questions, we'd say.
Sure.
So we're here to help.
Thank you. I am definitely going to take you up on that. So we'll be reaching out and thinking about ways that all of you can help us support that messaging. That's really important. Some of our other more recent updates include that Remsa Health celebrated one of its medical directors, Dr. Jenny Wilson, on being named a Nevada Business Magazine 2022 Physician Healthcare Hero. Dr. Wilson provides medical oversight to our ground operations and ACE-accredited medical dispatch center. We recognized Dr. Wilson's contributions to our organization and the community with a small reception earlier this month. Also, we partnered with the University of Nevada to produce a social media reel featuring Wolfie, Alfie, Luna, and our education manager, Jenny Walters, to remind citizens and students at the university in particular about pedestrian safety, particularly around the campus. This reel is our top performer with more than 23,000 plays and 1,200 interactions and more than 19,000 accounts reached. So we're very excited for that. And also, in the past few days, you may have seen that Riley, the Remsa Health raccoon, made their debut in Washoe County. A furry-friendly mascot, Riley is made possible through a partnership with all of you, the Washoe County Health District. You'll find Riley sharing all sorts of public health messages on the news, on social media, and even at special events around the community. Riley will encourage the public, particularly young Washoe County citizens, to understand things like the importance of learning CPR, signing up for Pulse Point, getting vaccinated, staying safe in hot and cold weather, water safety, helmet safety, pedestrian safety, proper car seat installation, and knowing when and not to call 911. So we are excited to see Riley around the community. Any questions I can answer for you?
Any questions? I have one. We have a tradition here when somebody's new, they take a picture with us.
Oh, well, we will bring Riley to the District Board of Health meeting in, that would be November.
We're looking for it.
We'll plan on that. Excellent. All right. Thank you so much.
With that said, do we need a motion on this one? Okay, thank you. Let's go ahead and go on. We're going on to presentation and possible acceptance of the FY22 strategic plan result, and we have Ms. Julia Ratty joining us.
Hello. And there it is. All right. Well, I'm excited to be here with you today to follow through on a prompt member. I asked them to do a conga line to come down, and they didn't comply, but I'm glad to see them all here to have my back. You may recall in November, about this time last year in November, we had our strategic planning retreat, and I do just want to take a moment to ground us, and I think I forgot to do the introduction. Hello, I'm Julia Reddy. I'm the Director of Programs and Projects here at the Washoe County Health District. So you may recall that we did a planning retreat in November of last year, and the thing that I want to ground you on in terms of our planning cycle is that you may recall that during the pandemic, we suspended our planning efforts. And so in last year's retreat in November, what we did was we planned for an 18-month cycle. And that was because we didn't have a plan for fiscal year '22, a formal plan that had been adopted. And we didn't complete that planning process until you approved the strategic plan in December, which really only left the second half of fiscal year '22 and then all of fiscal year '23, the year that we're sitting in now. So in terms of performance management, the team that you see represented behind me didn't start working in the performance management system with goals and outcomes and initiatives that were approved until midway through last year. What we chose to do, though, was still report out on a full year of outcomes and initiatives in our performance management system. So the report that you're going to see now is the full results from fiscal year '22. Just a reminder that the purpose of performance management is that continuous and systematic improvement of measuring and evaluating our performance for two reasons. One is accountability. We do a strategic plan with all of you. We want to make sure that we are making progress towards that strategic plan. But the other really is that continuous improvement process to inform both our at a management and leadership level and yours at a governance level decision-making. So typically in a planning cycle, you would do the strategic direction, set your goals, do your outcomes and initiatives, report that out to the Board of Health, and then utilize data. But when we're doing performance management, that wheel's gonna roll a little bit backwards. So now we've implemented outcomes and initiatives. Those are gonna roll up into our performance against our goals. So here is an example, and this would be a good time for me to orient you to. You have two documents in your packet. One is a roll-up. It is a scorecard that shows you a rating on every outcome and initiative, and then the one is a more detailed outcomes report that includes the actual targets that were hit on each outcome measurement and some analysis and narrative analysis towards that specific outcome. It's 63 pages long, and so right now what we are doing is we are sharing with you every outcome and initiative that we set across the district. And here's an example of just one. So we've got the district level goal that you approved in the strategic plan of promoting preventative health services that are proven to improve health outcomes in our community. At the division level, we're acting as a safety net by providing accessible health services when and where community members otherwise might not have access. Our outcome that we're going to measure, or one of our outcomes that we're going to measure, is the number of clients that were served by the immunization program, and our initiative to accomplish that is more outreach in our immunization and services. So hopefully you're seeing the flow there. That 63 pages basically has that same layout for all of our goals from the strategic plan and all of the outcomes and initiatives that were approved to work towards those goals. So at initiatives, and this is the work we do, right? This is how we are trying to accomplish the goal. When our staff went through the performance management system and using ClearPoint, which is a new software system that we onboarded last year, they rated about 57% of the initiatives as on target, about 28% as in progress, and that just means that they weren't able to accomplish it in the fiscal years, but they are still working towards it. Some as off target, and I'm always want to be cautious with a red, yellow, green system. Some of them may be off target because we made a strategic decision not to pursue that anymore. Some of them may be off target because monkeypox got in the way and we had to set some things aside while we were working on others. There's lots of reasons why something might be off target. And then in this case, we have 9% that are not started, and that would be because of the 18-month planning cycle. So when we planned for some things to start in fiscal year '22, some to start in fiscal year '23. So if they're not started, it just means that it was a fiscal year '23 outcome or initiative. Make sense? So then if you look at our outcomes, 64% on target, 21% in progress, 9% off target, and 6% not started. So then going back to our performance management reporting wheel, what we did is we take those initiatives and outcomes and we roll them up using a scoring methodology to also give a rating for the division goals and how we are going towards meeting those goals. So we use a point system to delegate a point to each outcome based on its reported status. So if it was not started, we just removed it, didn't count it at all. If it was off target, there were 0, in progress 0.5, on target they got 1. And then we divided the sum of those to get to by the outcomes linked to the division goal to determine a final score for that division goal. So again, we're rolling up, how did we do on the outcomes and initiatives underneath that goal to come up with a score for that goal? And so what you'll see is based on that methodology, we think that we're on target for 64% of our division goals. We are in progress on 22% of our division goals, off target on 7%, and not started on 7%. So then those division goals roll up into district goals. So again, we're working at the division level, but there are some things that that go across divisions and affect the entire district goal framework. And so in that case, under district goals, that roll up resulted in 77% on target and 23% in progress. So basically what that's telling you is every goal had some action, some initiative, some outcomes that contributed to everything ending up in a green or yellow status, but not every outcome and initiative was on track underneath each of those goals. So now we are here, as promised, to report back on our performance management to you at the District Board of Health. And so I'll just pause here to say kind of where we are in the cycle. So I kind of consider the first year a bit of a practice run, because again, we didn't set our goals and outcomes and initiatives until mid-year, even though we were reporting out for the full year. Right now, what is happening is that the teams are working on a confirmation and refresh. So they're taking the learnings from the reporting and the work that they did in fiscal year 22, and they're making an update based on those learnings to the outcomes and initiatives for fiscal year 23. So again, that's all still in the same planning cycle from our retreat from last November. So that'll take us through fiscal year 23. And the next step that we'll be taking forward is that you are getting an annual report for fiscal year 22. Starting in fiscal 23, the year that we are in now, you'll start to see quarterly reports. So we'll be a little bit late on the first one because we're in our learning process, but moving forward for the rest of the year, you'll start to see quarterly reports for each of these outcomes and initiatives. And then again, we are utilizing that data in a learning process to refresh, update, and continuously improve how we talk about and measure the work that we do. So what we're going to do now is, it's lovely to see all that roll up, and you have the detail for every single outcome in the packet that you have before you. But we're going to turn it over to the division directors to just do a couple of highlights for you, just like we did in the retreat last year, so you have a little bit of context. Obviously, there's 63 pages. They're not going through them all, but they've just picked a couple each to highlight for you some of the successes we've had over the last year. And so I will turn it over to Francisco Vega with Air Quality Management to begin.
Thank you, Ms. Ratty. For the record, Francisco Vega, Director of the Air Quality Management Division. This first achievement that I wanted to highlight for you falls under district goal, protect people from negative environmental impacts. Division goal, monitor ambient air to assess attainment status of the ozone and PM 2.5 NAAQS. Outcome, achieve a 75% data capture rate for ozone and also PM 2.5. And then initiative, follow EPA QA/QC data capture requirements and report data capture rate on a quarterly basis. Obviously, the goal there was 75%. As you can see, we achieved greater than 98% on both ozone and PM 2.5. We take great pride in monitoring the air quality and providing the most current and up-to-date information for the residents of Washoe County. Beyond just assessing our attainment status with ozone, again, this information provides critical information for the residents so they can be protective of their health as well. The second achievement that I wanted to highlight was fell under district goal, reduce risk and improve health outcomes for children in Washoe County. Division goal, provide quality and timely air quality data for students in Washoe County school district staff. Outcome, integrate low-cost sensors into Washoe County School District schools and in historically underserved communities, and work with the Washoe County School District to identify schools and install low-cost sensors. I don't think it's up there, but we had a goal of trying to install 6 actually low-cost sensors throughout the region in underserved communities. We actually were able to work with the school district to get 10 installed at various schools. So again, very critical. We know how air quality can vary 1 mile to the next, 100 feet, from one another. So it's really critical to fill out those kind of spatial gaps in our monitoring network. We have 7 regulatory required monitoring stations. So these low-cost sensors are, again, really critical in filling out those spatial gaps. So just wanted to highlight those couple of achievements. Again, there's just a couple examples of what we have achieved within our division. More than happy to answer any questions.
Yeah, let's go ahead and make sure we do. If not, we're going to have too much on our brain and have to go back. So anybody have any thoughts on our questions or anything we'd like to ask about? I do. So, okay. Well, I'll go ahead and start. The one, I'd say good work. So I want to make sure we always had the 7 because that's required. So now we have 17 floating around the community that are sensors that are in there that are helping collect that data that we need. Is that?
Yeah, so let me make sure I understand the
I know they're
question.
not the same. We have 7 large things that are required, our air quality handlers that give us all the information, like the one we went to the other day and stuff like that. But then you put 10 new, more affordable sensors around to different schools
Correct.
doing the same. So now we have, does that all feed into to give us better information as well from the region?
Yeah, excellent question. So just so it's clear, we do have 7 regulatory monitors throughout the region. Those are, cost tens to thousands of dollars. Obviously, we can't afford to have those everywhere within the region. So these low-cost sensors, which typically cost $200 to $300, still collect very valuable data and, again, help kind of fill those spatial gaps. But that is correct. We do have 10 of these low-cost sensors spread throughout Washoe County at schools.
I think that's fantastic. One of the questions I have at large, and this probably goes to each of you as we go, I think it's important, and maybe we can even, maybe you don't even have the answer now, but are there barriers in place that there's something that, as mentioned by Ms. Ratty, that there's some barriers that are just barriers, monkeypox, you name it. There's some barriers we can do something about. Maybe there's something that, hey, we really need this, but it's a barrier. That's something we'd want to know. And I say that may be something that would be wise. Again, doesn't have to mean you have to make it up right now, but maybe in our quarterly reports or something that we are making sure we get that. But that'd be one question I'd ask if you did have anything. Those are the kind of things I think I'd like to know, and I think our board would help us to say, hey, that's fantastic. Let's make sure we can do things to help you continue to move forward.
Absolutely.
Okay, thank you.
Thank you.
Good afternoon. For the record, Erin Dixon with Environmental Health Services. Oh, hold on. Okay. I want to highlight 2 of our programs, 2 of our goals. First, I want to share some of the good work that's been going on in our vector-borne disease program. This is under the goal of reduce the spread of vector-borne diseases. Every year, we have some aerial mosquito treatments. And what I think is so impressive about these is that the program has been so specific and targeted on where these aerials occur that you can actually see the surveillance activities result in a decrease in mosquito activities once these have occurred. So the team really does look for where the increased mosquito activity is occurring. And once these treatments do occur, then they're able to monitor and prove that the activity did go down. We attempt to do 4 every year, and that is really our goal and what has been successful in the past 2 years. And I know this didn't happen before July, but once again this year we did not have any West Nile that tested positive. The next program I'd like to highlight or goal is to reduce the negative environmental health impacts associated with land development. And just a reminder, our land development program does reviews of private wells, private septics, and our water systems. So the number of plans with review, inspection, and approval was all completed. And the initiative was to update the SOPs and develop standard comments. The goals with all of this, the SOPs, were really to make a standardized system and additional comments so that it's better customer service for our those that are submitting plans. and a more consistency, and that was very successful. In addition, at the same time they were doing this, the number of plans with review and inspection has increased up to 25%. And just as a reminder, as these plans are being developed, as our community expands, these plans are a little bit more on complex parcels, which makes those standard comments that much more valuable. And that's it, if you have any questions.
Any questions? Okay, thank you.
Great, thank you.
Lisa Lottridge, Division Director for Community Clinical Health Services for the record. So I would like to highlight 3 of our goals. So I'll start at the division level. So the goal, act as a safety net by providing accessible health services when and where community members are otherwise not able to access them. So for the outcome was to increase the number of clients served by the immunization program, and the initiative was to provide outreach immunization services. And boy, did we do that this year. So within the fiscal year 2022, the immunization program and the COVID pod team conducted 167 off-site or outreach events. So this is outside of the complex. This doesn't account for any events that were done here at the post-pod location or within our 4 walls. So this includes our back-to-school clinics, our flu pods, high school meningococcal events, as well as outreach events where we went to Gerlach, Cold Springs, or Incline Village. And then the next one I'd like to talk about is division goal, build a bridge between communities. Sorry, what? Oh no, my finger's too. Is that it? That is it. Okay. No. Oh, okay, here, let's see.
There it is. No.
There it is. Okay, I'll just go back one. Build a bridge between communities, clients, and services with our community health workers. So the outcome was community health workers will provide education and or referrals. With the initiative was to integrate community health worker positions into all of our programs, which are listed. So in fiscal year 2022, we did do that. 3 community health workers were integrated into all CCHS programs. And what we did is each of them has 2 programs that they work in. And they go to all of the meetings for that program. They have assigned projects, and then they're also seeing clients. And an impressive number, they doubled the number of individual clients they saw in the first quarter of this new fiscal year compared to the last fiscal quarter of fiscal year 22. So they all came on board at the end of March. So, onboarding and all that, but they're already really hitting the ground running. Okay, go back. So now, division goal, increasing community partnerships in physical activity and nutrition programs. Increase the number of corner stores engaged in offering healthy foods. And the initiative provide education and technical assistance to store owners. The accomplishment within fiscal year 2022, 3 stores participated in the Healthy Corner Store program, Grab Healthy program. All 3 participating stores offer canned and frozen fruits and vegetables. Staff are conducting customer and store owner surveys now, and for the evaluation phase of this program. And then we're working on recruiting new stores for this upcoming fiscal year. Okay. And that's all I have. Any questions?
Any questions from anybody? Thank you very much.
All right, thank you.
Thanks for the update.
Hi, Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. So for the health district and for the EPHP division, one of the key goals we wanted to target was our ability to disseminate to the public accurate public health data. And this is important for us to build trust and timely communication so the correct information can be used to combat any miscommunication or confusion that's circulating. So our listed initiative was to establish EpiNews, to publish EpiNews monthly, and EpiNews is being disseminated by the epidemiology program to over 800 subscribers and is posted on our website. And during fiscal year 2022, the program published 24 EpiNews articles covering themes of back-to-school disease series, travel-related illness, seasonal viruses, hepatitis awareness, and multiple health alert network distributions from the CDC, such as with monkeypox, highly pathogenic avian influenza, acute hepatitis in children, and COVID vaccines and treatments. So through this, we are aiming to make providers and the public aware of circulating illness trends and updates to any relevant information. Is it stuck? Oops. Okay. So for our district goal 4.6, we seek to improve the ability of the community to respond to health emergencies. And it's our division goal to improve public health emergency preparedness through engagement and support to our partners. And one of such is our schools. The Board of Trustees of each school district and the governing body of each charter school and private school are required to establish an emergency operations plan committee to help develop and update a plan to be used in responding to crisis, emergencies, and suicides. Since 2021, it's been required that school need to have at least one member of such committee be a representative from the county or district board of health. And to support the efforts of our schools, the Public Health Preparedness Program reached out to our schools as an available resource. And in fiscal year 2022, we participated in planning committees for 14 schools total to provide input to their emergency operation plan discussions. So through that, we're aiming to increase preparedness in our community as a whole, which will in turn be able to improve the ability of the community to respond to health emergencies. I'm happy to answer any questions.
Any questions? Are we doing some of those emergency trainings inside of any of our homes, our senior homes, or any of those? Is that anything that is ever part of the conversation?
Well, when we do a lot of emergency trainings or exercises, we aim to be having our community involved and our partners involved so that we try to, if possible, get as wide of a participation as possible so that we are having this connected response from our community when things do happen.
I would bring it up. I get to work in that field a little bit and what I do, but I do know there's, depending on the rigor of what they did or didn't do discipline-wise, I think there's a wisdom in us preparing for future things, is that's one area that probably could use your expertise. So,
thank you.
Thank you. Any other thoughts, conversation? Thank you.
And then I'm going to speak on behalf of ODHO for a couple of initiatives. So one of our efforts was around attracting and retaining a talented public health workforce and creating a positive and productive work environment. You may recall in the last budget cycle, you invested some additional dollars for us to really work on workforce development. So one of our initiatives was to build out additional onboarding activities for new employees. And so we were successful in building out a 6-month onboarding program for new employees. And I will just jump to this slide. So this is actually now an onboarding map that every new employee receives. And there are different steps for the 6-month program. So our team and ODHO engages with each employee several times over that 6-month, including a evaluation of asking them for their feedback of what their experience was as a new 6-month employee. This map also kind of helps new employees understand that in their first year, they're under what's the word I'm looking for? Your 11 months probation. Thank you. Thank you, Lisa. And so it shows them that they're going to have a 3-month evaluation, an 8-month evaluation, an 11-month evaluation as part of that onboarding so that they know what to expect. This has been well received, I think, both by the divisions and the new employees. We're just getting started with this. And then this also overlays with the additional onboarding that they get at the division level for their specific program and expertise. So we're hoping that this will pay great dividends in having employees feel welcome, feel up to speed, and ready to hit the ground running as part of the health district team.
My only concern is they don't get to eat lunch for 4 months.
That's true. That's true.
We don't feed them.
Well, and that's true of all of our staff, our existing staff as well. So, we have to give a reality check to join them. In all seriousness, that we actually feed them a couple times as part of it. And their scavenger hunts. I mean, we're trying to make it engaging and participatory. And then speaking on behalf of all the divisions and some initiatives that were led out of the Administrative Health Services Division, one of the things we talked about, I think, was that we were bursting at the seams a little bit here in the health district, a lot of additional staff, not so much additional space. I think the building might be shrinking. And so we really needed to maximize our space. And so there were a number of projects that were specific to this, including a significant remodel of the front lobby of the air quality management division that turned into our vital statistics. This makes the vital statistics space much more accessible to the public, but it also creates some space in the Clinical and Community Health Services Division to house those wonderful community health workers that we just talked about. There was also some new workstations freed up in all of that. It's not in the slide, but I also wanted to emphasize one of the things we're also adjusting to is a more hybrid and remote workforce. And so we were able to upgrade 4 of our conference rooms to be Teams smart rooms so that it's a pretty much seamless experience if you've got a team that's partially in the building and partially out of the building. And then we were able to create 8 hoteling stations. So there are a handful of us, a very small number of us right now that don't have an office. So if you have the opportunity to work remote, now when I come in, I have 8 hoteling stations throughout the building that I can choose from. We also did a lot of doubling up of staff members in offices. And so those doubled up staff members, if they both have a meeting or something simultaneous, they can also choose to move into those hoteling sites. So it's just giving us more flexibility, more adaptability to this growing workforce and trying to use the space in a smart way. And again, collaborative effort across the entire health district. So just to wrap up, I just wanted to talk briefly about where we're headed. And so fiscal year 22, there's your fiscal year 22 results. In your packets, what we did do, and with great thanks to all of the divisions for their hard works on this, where it was available, you have 2021 results as well. Where performance management starts to become valuable is where you can see the trends over multiple years. So if you're looking at the outcomes report, you'll see a 2021 reported number, a 2022 reported number. We are updating the fiscal year 23 outcomes and initiatives as we speak. That's the year that we're in now. And then in in November, we'll have our retreat. We'll refresh the strategic plan for the fiscal year 24 to 26 period. And in January, the staff will start working on their outcomes and initiatives for the next annual cycle. At that time, we're bringing in on strategy to do some coaching and mentoring for us on terms of how to write the strongest outcomes and initiatives. I will say one thing that we struggle a little bit with here at the Health District is a lot of what we do is preventative. And so it's sometimes difficult to demonstrate that you've prevented something. So I think you had a great example with West Nile, where if we did 4 mosquito treatments and pretty quickly you can see that there were no West Nile outbreaks, pretty easy. But if you talk about Healthy Corner Store, where we got people healthy food, the fact that they're not obese 10 years down the road is a little bit harder to measure. So we are going to be working with On Strategy to update our outcomes and initiatives work. The other thing that we're going to be working on is a key performance indicators framework. So right now you have 63 pages of outcomes and initiatives, and that's good work for a management and leadership tool for all of us to be working at the programmatic level, division level, to be working to improve our decision makings. Not a great governance tool. And so over that time, we're going to be working with you to come up with a smaller set of key performance initiatives that we could report out in a more dashboard form on a more regular basis. So that's where we're headed. And with that, that's the end of my presentation, and I'm happy to answer any questions.
Let the record show, Dr. Dango left, just want to make sure that's clear. But any questions, or would anyone like to cheer them on? They did a fantastic job.
Thought it was very thorough.
Yeah. Well, and, go ahead, sir.
Thank you, Chairman Dare. Ms. Ratty, thank you for the thorough presentation. As the new member on the block, I did spend some time looking at the 63 or 66 pages, can't remember which, just so I could get a sense of all the good work that you're doing. But I will say, more than that, the care with which the report was put together was incredibly impressive. Each of us on this dais spend a fair amount of time looking at reports, especially ones that are so strategic and very all-encompassing. And every report's not created equally, right? People want and have the best intentions to, but this one is one of the better ones that I've seen in my time. And so I just thank you for the thoroughness of it. The presentations by each of the members of the team are equally as impressive. And so for me, as I come into it from a new perspective, I just want to say wow, and a very impressive start. Will be, I'm sure, hard to have a benchmark against for the next 4 years, but if this is the start for me, I can tell it's going to be a very good start. So thank you for that.
Thank you.
John, did you have something you want to say?
Okay, real quickly, I echo exactly what he said. I did wade through all 63 pages. I like the colors, the dots, because you can go back and follow where we are. So I think it's going to be a great tool as we go. I know it's still a big struggle to try to get your hands around all of this for the whole health department, but I really got to commend you. It's a great start to both of you, so thank you.
Yeah, I think fantastic, and I do think a dashboard will help even you guys. It'll help us, but I think it gives you guys a little bit more, you can kind of watch it in action a little more than trying to see the big thing all the time. And so, but I will echo, we get to see a lot of these, and not all reports are created equal. I'm going to use that quote somewhere again, but this is done very well from all of you. Thank you.
Thank you. I very much appreciate the kind words, and I think this is an important time to note that it literally takes a village on this. So I want to commend Rihanna Lavoie and Camille Haga, who did the organizing and the work to pull all of it together, and all of the division directors and all of the supervisors that had to do all of that reporting. We have put them a little bit through the ringer with a lot of other things going on. And if I could ask each of you to report back to your teams that at least 2 board members read all 63 pages and maybe a couple more. It is meaningful to us that you care about what's in those reports, and we appreciate the kind words. Thank you.
Oh, this stays with me in bed. I hang out with it. No, that's fantastic. I would say we would need a motion on this. So if we have, anybody would like to take a motion? To make a motion?
So moved.
I have a first. Do I have a second?
Second.
And any more discussion? Seeing none, go ahead and all in favor? Aye. Any opposed? And that passes unanimously. Okay, now we're moving on. My screen's stuck. We're moving on to our recommendation to approve the compensation for the district health officer at employee's current hourly rate of $95. Leave accrued more than 240 hours in a calendar year and approved payment of $8,016.12, which represents compensation for 84 hours of annual leave that cannot be used in this year due to work requirements. The only thing I think we also vote on is that you should go on vacation. But any questions, concerns?
Was that a motion?
Well, sure, I will make the motion that we accept this. Do I have a second? Any other discussion? All in favor?
Aye.
Any?
Thank you.
Passes unanimously, thank you. Okay. Someone needs to vote, this thing gets stuck. There you go. Now we have the review and approval of the district health officer's annual performance evaluation. Lori Griffey.
For the record, Lori Griffey, the HR rep for the health department. You in front of you in your packet, you have Mr. Dick's annual evaluation. As you can see, 27 of the 39 people that it was sent out to did respond. So we had a 69.23% participation rate. Each survey had a question that asked for them to select the best statement for the overall evaluation of the district health officer, Mr. Kevin Dick, and 96.8 or 94 96.94% voted that he met or exceeded their expectations, which is a great response. The rest of the questions were all added together and came up with a overall participation and quote of 90, let me see, 92. I'm sorry, grabbed my wrong paper. Okay. We've got 60.57% of the overall questions said that he exceeded their expectations. 35.37% said he met their expectations, and only 4.06% said there was area for growth. So overall, Mr. Kevin Dick has more than exceeded the expectations of our participants, and I leave it up to the board to approve or follow through on his evaluation.
Oh, any discussion? And then you, any discussion, any questions?
I do have a question, Mr. Chair. It's for our legal counsel. I did not understand a part of the report, and it may be due to my unfamiliarity with something related to the HR processes for the human resources function. I don't think it's appropriate that a person does not receive a cost of living increase raise. So it says that Mr. Dick is not eligible, I suppose, because he's at the top of the salary range. So is that, again, because I'm not familiar with Washoe County, and I know we piggyback on there, that again, doesn't make a lot of sense to me. So can you give me some understanding of why that occurs?
And I apologize, I don't have that information right offhand to speak to why that works, and I'll defer to Ms. Griffey, who can probably give a better explanation, but I believe it's tied to the way the Washoe County compensation works. And so what generally happens is once we've reached the top of our pay scale, I think that there's a cap on where we go, but Ms. Griffey may have a more comprehensive explanation than what I just offered.
She's actually correct. Each employee is in a certain wage range, and once we hit the top of that wage range, from there forward, we generally just get the cost of living that comes through annually, and those were approved for Mr. Dick 2 months ago, for him to receive the cost of living increase the same as everybody else got.
Yeah, if I could clarify.
Please.
So the top of the range is adjusted each year when they do the cost of living adjustment. So I'm not, since I'm up at the top of the range, I'm not eligible for a merit increase, but I do get the cost of living increase, and I appreciate you asking and your concern for that.
Okay, that is a bit better explanation for me. Thank you so much.
Very good. Well, I am looking for a motion to accept.
Motion to accept the annual performance evaluation results.
So we have a first. I have a second. Any more discussion? Seeing none, all in favor?
Aye.
Any opposed? None. That passes unanimously. And I'd like to say, I mean, we've all danced together now for quite a few years, a lot of us, and different things, and we have a lot of things coming. And this is a very good report. I know that in life we get, not everybody on here said all exactly the same things and stuff, but I think no matter what somebody put, it's always a learning experience and things that we get to focus it on. So I look forward to walking with you in this next year or so and continue on. Do you want to say anything, sir? Do you want to say anything?
Yeah, I just want to thank everybody very much. I was pleased to see the overall response that I got. Very pleased to see the response from my direct reports. I certainly could not do this job without all of the talented people at the Health District pulling together and helping to make it happen. So thanks, everybody.
Very good. Okay. We are on to our staff reports, and that brings back up Francisco Vega and with the air quality management.
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. I did provide information on 3 items in my report, and I'd just like to highlight them for you here. The first one was that NDOT received $38 million for highway electric vehicle projects, and this was part of the Nevada Electric Vehicle Infrastructure Deployment Plan. we were able to participate in that process and provide input on kind of where the charging stations should go and where the funding should be spent. So very good process, and we're really happy to see that the funding was received. The second one was I provided information that EPA announced that they were actually almost pretty much doubling the amount of funding available for the Clean School Bus Rebate Program. It went from $500 million, which was initially the funding, almost to $1 billion. Our role in that as the Air Quality Management Division is really just to provide information on the funding available. So we don't actively have a role in where the funding goes, but we will always provide letters of support. For example, the school district was interested in applying for that funding. Again, we would support that effort. So, and then lastly, wanted to update the board on the status of the ozone standard review by the Clean Air Scientific Advisory Committee. That actually has restarted. I believe I previously reported that they took a kind of a pause on that review. They have restarted and I believe met this month. So kind of next steps in the process is the advisory committee will report out to EPA with any kind of advisements to EPA, whether or not to strengthen the standard or pretty much leave the standard as is. I will certainly update the board as I get more information on that process. And with that, I'd be more than happy to answer any questions.
Any questions? Do we reach out to the school district and say, hey, there's a thing here, or we just wait for them to try to get a hold of us?
No, we definitely do. So as we receive this information, we have great contacts with the school district. Say, hey, this funding may be available to you. Actually, I think with the first round, the $500 million, I actually don't think Washoe County was part of that funding. I think it was more for rural and underserved communities. I think with the next round, the additional $500 million, they may be a part of that funding.
Wonderful.
But again, we get that information. We don't apply ourselves. We definitely provide that information into the school district, and then again, we provide any kind of support we can.
Good job.
Yep.
Thank you.
Yep.
Lisa Latritz, did I say that right? Now I got to remember get everyone's name down right. I'm in trouble.
Okay, Lisa
Community and
Latridge.
Clinical Health Services.
Yes, Lisa Latridge, Division Director of our Community and Clinical Health Services. I just wanted to highlight two things. In our divisional update this month was on fetal infant mortality review. And as I discussed as one of our successes is our community health workers. And in this review, it talks about just the accomplishments of this community health worker that's assigned to FEMR in the short time that she's been there. So it's on the third page of our report, and it's just a list of everything she's done, from being trained already as a Cribs for Kids instructor, so people are able to come here and get, if they don't have a safe place to sleep their baby, they can come here and we will give that to them, and then provide them education as well. And then updating our materials. She's just been doing a great job. So just wanted to highlight that. And the other thing is, Kevin mentioned we're doing approximately 7% of the COVID immunizations for the county. But what I want is I want to give a shout out to our immunization team. A big part of what we're doing now is the transfers to providers that are now doing those immunizations in their offices. Answering calls. We were in a meeting, we get frantic calls from providers. I did this, what do I do now? So our role is changing, but it's changing in a good way. We're teaching our community how to handle this so that we can go back to what we were doing, what we're supposed to do. So those are just the two things I wanted to add, but I'm happy to answer any questions.
Any questions? Thank you so much.
All right,
Appreciate
thanks.
it. And now we are on to Aaron Dixon with our Environmental Health Services.
Good afternoon. Again, for the record, Erin Dixon with Environmental Health Services. You have the report in front of you. I just want to highlight A few things. The highlighted program this month is our underground storage tank program. Just as a reminder, we have approximately 220 underground storage tanks or systems in Washoe County, and these are the tanks that hold our basically our fuel at our gas stations. Our team not only does annual inspections on these tanks, but is also responsible for construction and when they come out of the ground. The report goes into significantly more detail about what happens during those inspections, but also just wanted to highlight that when those tanks are taken out, we do the soil sampling as well to make sure that they haven't been leaking, really to make sure that our community is safe. Would like to highlight just a few things from our other programs. Our food program, last month you asked about exactly how many hours it took for the rib cook-off. It's actually 99 hours of straight staff time that took for the rib cook-off. In addition, I promised you that I would bring a copy of our advertisement for our promotion for our excellence in food safety. The 2020 winner was BJ's, and we are actively out there looking for nominations for our next winner. So please continue to promote that if you can. Also want to announce that, as I reported earlier, our food safety team was asked to be a mentor to Guam and Saipan, and Amber and Kristen recently returned from that trip, and great learnings, was really able to help out those two jurisdictions, and have great information that I'll hopefully share with you in the next report. So our land development. Our land development team works with many property owners. Sometimes things get a little contentious, and our senior environmentalist for the program was served a subpoena and was called to testify between a previous owner and the new owner, and that did occur on October 7th. In addition, our team leadership went down to Carson City Health and Human Services and provided an overview and training for their team on how our program works and the septic regulations that we follow. In addition, for our safe drinking water team, we did experience a boil water order for a smaller system that had chloroform and E. coli, and they were able to work through that system, make sure the testing was conducted in the proper way before that boil water order was released. In addition, we have 21 of the 25 sanitary surveys have been completed. And from our vector-borne program, we had a total for this season, 505 mosquito pools were tested, and seasonal staff treated 3,407 storm drains. So we rely significantly on those temporary staff as well. And that's all I have for my update, if you have any questions.
The only thought I have is that, when you're doing those awards, if you could share that with us, I'd like to come down and congratulate when you do it, and I think some of that stuff might even make these guys a little more,
Absolutely.
But I'd ask our board to be watching for them, and so you can be actively involved and have some fun with that.
Okay, absolutely. Thank you very much. And if at any point, I know I've offered this before, if you are more interested in one program or another and you want to go on an inspection or get some additional information, we're happy to make that happen as well.
Thank you.
Chair, we have Dr. Novak signed in on your tablet.
I don't want to put you on the spot, but there was a thing on TV about noon today about an area water system checking individual wells and stuff. I think they said it's under Healthy Nevada, but it may not be. That they're starting to find arsenic and lead in some of the private wells, and there was like about 260 of them. So might give you a heads up to kind of watch for that on the official angle, not on Channel 2.
Well, thank you very much. We actually are starting a project. It's not completely finalized yet, but with DRI to work with some of our private well owners to help them get their water tested and to encourage that they get their water tested. We're primarily looking at nitrates, but I do know the DRI is also looking at arsenic as well.
Yeah, it came out today on the news.
Okay.
That's not a good thing to have in your water.
No, it is not. Okay.
Thank you. Anybody else?
Thank you.
Thank you so much. And Now we're on to epidemiology with Nancy Dow. And you're walking. Very good. No more boot. Congratulations.
3 months.
Ski season.
So, good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. You have my report. I don't have anything to change or add. A quick update in influenza surveillance with the flu season on the horizon. We have added via our social media channels infographic circulation in addition to our weekly report to increase awareness in the population. And the health officer did already cover the trends that we've been seeing so far with flu. So hospitalizations, yes, we started to see some activities after week 40, but still remains consistently low. So far, RSV did see a noticeable jump since week 39, especially these recent 2 weeks, but numbers are still fairly low. And nationally, the predominant circulating strain of flu has been the H3N2 strain, followed by the H1N1. And for outbreaks that's been reported to us, we did see an uptick in August because that was back to school season, but that number dropped in September. And now that we're back in October, we're still trying to keep an eye on it. We're seeing that number climbing up a little again. So that's all my updates. I'm happy to answer any questions you may have.
Any questions? Thank you so much.
Thank you.
And on to you, Sir District Health Officer. You got your report.
Yes, thank you, Chairman Dare. I just wanted to highlight a few things. Our health equity team has been very busy. They did a community listening tour where they had 29 meetings with 59 community leaders, and they've been working on finalizing our health equity organizational capacity assessment and our health equity organizational capacity plan. And that'll be part of what's presented to you at the retreat on November 10th. We held a CHIP forum on September 30th at the Convention Center. We were pleased to have about 120 members of our community participating in that to hear results from the community health assessment and to provide some initial input around priorities for the community health improvement plan. I will add that it was evident the work that our health equity team has been doing as far as the engagement of a number of those participants that were from minority or disability representing organizations in our community. And a number of those are participating on our CHIP planning, the planning committee for the CHIP. We held a family health festival at O'Brien Middle School, another successful event, this one focused on breast health. But these are these family health festivals. We have a small and committed group of partners that work with us to organize these events and engage a much larger number of organizations in the community that participate in providing services at these. And we were pleased to have Anthem Blue Cross Blue Shield that sponsored this event. And then I just also wanted to let the board know that we did have all of the interlocal agreement amendment signatures that we needed to get from the jurisdictions for the name change. So that is official. The amendment has occurred. And we are working in the RFP process to bring somebody on for the that rebranding effort. So the bids are in, the discussions are occurring, and we hope to have somebody moving on that quickly. So the name change will be official January 1st. We may not roll it out on the 1st. We've got some work ahead of us with the rebranding, but we're working to get there. And then just a reminder, the strategic planning retreat is on November 10th from 1 to 5 p.m. That will be over in the auditoriums A and B off of the Health District lobby, so not here. And this is more of a workshop environment, a casual environment we like to have. We had to threaten Christopher Dare with some scissors regarding his tie at one of the one of the past meetings. So just a reminder, we're looking for casual.
They held me down, and I had to be like, no! That was, exactly.
Yeah, that's my report. Happy to take any questions.
Any questions? Very good. I would just want to say on that, what he just mentioned, please come ready. I do want to say this because it's not wrong on your calendar, because sometimes when I see a four-hour meeting, I just think somebody messed up. It's not a mess up. It actually is going to be about 4 hours. And there will be food, and there'll be some drink, and there'll be some things in there to kind of keep us sustained. We'll take little breaks here and there, but it's going to be a definitely worthwhile time. And I say this even with those coming on, it'll really kind of give you a good span of what is happening, and you get to speak into it. And that would be my strong encouragement. I think our staff does an incredible job, but they really are looking to some of us for some conversation. And so please come ready with some ideas to be able to talk and share and make sure you're there, okay?
Mr. Chair, if I would.
Yes.
Before we move on, Mr. Dick, I wanted to just say thank you. I have been getting the media updates fairly routinely in my email, and those have been particularly helpful for me. First of all, because I spend a fair amount of my time promoting various interests on social media, oftentimes that information, and to the extent that whatever following any of us have as electeds, I think it's one of the things that we can do positively on social media. So I really appreciate those updates. So I want to just commend you. I see a part of the presentation was about media and outreach opportunities. I understand that you have a great team behind you, but those are particularly useful to me, so I thank you for that.
Very good. Thank you. We're going to go on to board comments. Does anybody have a board comment or something they'd like to bring to the board? Yes.
I do. So, RIMSA did an excellent report with everything they provided, but one thing sort of jogged my memory here. The education side of things when it comes to educating the folks on when to use 911. They talked great length about what they're doing. I want to know from the health district side of things how we can actually get that word out better, not only with what RIMS is doing, but I think we need to incorporate and include, our public safety agencies across the board so that we're all stating the same message. We've got an excellent training opportunity with our fire departments, our law enforcement. They get into the schools, and this needs to start in schools. If anybody remembers when we used to use a seven-digit number and we rolled over to the 911 system back in the 80s, you had 911 plastered on every police car, every fire truck, every ambulance on the education of using 911 in case of an emergency. And now we're relying on RIMSA to do a lot of education on this. And back in the day, we used everybody. We incorporated all the services, the agencies, to do the education part together. And with social media today and how all the agencies use social media, RIMSA social media program, I think we need to ensure from the health district side of things that we're saying the same education out there when it comes to the utilization of our 911 system. Barry did a great report. I think you got everybody's eye when you talked about 8,000 calls and 5,000 transports out of 8,000. Well, we got to remember that's probably 8,000 responses our neighboring agencies did with them because of our tiered response. And they feel the crunch when it comes to the fuel, replacement of equipment and everything else, but it also takes those services of our fire departments, our law enforcement, along with our ambulance providers, at the same time out of service for those unnecessary calls because of using the system in an unnecessary manner. So Kevin, however we can do that, and then, maybe get a report back that, we're working towards that in the future, because you see the RIMSA folks with their ads and what they do a phenomenal job. But we put firefighters, we put law enforcement along with them to echo the same educational, opportunities out there, and I think we'd be far ahead and probably decrease those responses that are taking place every single day. So just want to say that and see what we can do about making that happen.
So if you need to bring something back to us, you would do that, however that functions. But I'm not allowed to agree because it's not allowed to agree. I don't agree, but I do.
Kevin,
I don't.
Just want to add to what Chief Brown said. I think we need to include the hospital systems, because what RIMSA takes to them is not always the best stuff, but RIMSA can't make that decision.
We need to be careful. We don't start a conversation. Our lawyer's about to turn on this microphone. I'm watching her.
I want hospitals added to that.
That's good. And we can talk all about that next time we're together. So I do want to add something that I'd like to be brought back to us, and this is a challenge to all the board members. When I came on, one of the things that we did is we took an area. So I've been walking with air quality, meeting with them, making sure I know what's going on. I'm not sure if each of you have an area you're doing that with. I say this, that you should, and I'm going to ask you to. I'm going to ask you to open your mind, your heart, and find out where you want to fit. Find something that you get to be our representative, our expert a little bit in on what, we have people come giving their reports all the time, and I want to make sure that we truly understand what's going on, and you are our best eye for that. So if you go and meet with them a little extra, go on a drive along, or go, whatever it is. I mean, they keep offering to invite us, and then I do think we can move that around a little bit sometimes. I mean, I like hanging out with Francisco, but it might be good. So I want to talk about that and see what that could look like. Yes, sir.
Oh, I just had a quick question back on the 911. I was just going to,
If
Kevin,
there's a
I'm sure.
discussion, she's gonna reprimand me.
I'll talk to Kevin afterwards.
Thank you. I appreciate that, but we hear you, not really. Is that a good way to say that? He never spoke, so
Yeah.
very good. Any other board comments that are not having a discussion? Thank you so much. And, down to adjournment. Thank you all for coming, and we'll be here same time next month. Thanks.